Department of Health is reporting the highest number of patients in hospitals and ICUs since August. Those numbers have been trending upwards since October and are limiting the number of open ICU beds across the state. And that is putting increased pressure on smaller rural hospitals like Winston Medical Center that do not have their own ICU facilities. WCBI's Pimpo talks with them today about how they're handling the issue and joins us live in the studio.
That's right, Joey. Winston Medical Center CEO Paul Black tells me the county is nearly back to their highest 7-day average of new COVID-19 cases since the start of the pandemic. Black says they have plans in place to make sure they can house as many patients as possible.
There's going to be limits to what we can do, and that we're going to try the best we can to take care of the residents or the employees or the people of Winston County.
With just 14 acute care beds and no ICU, Winston Medical Center is one of many rural hospitals that are working to accommodate as many patients as possible as the number of coronavirus cases in Mississippi continues to rise.
We don't have an ICU, so if the patient gets to that point where they need an ICU, then we're trying to transfer them somewhere, even if they're in the ER.
When Winston Medical needs to transfer a patient, they'll call up larger facilities within a 100-mile radius to see if they have any beds available. If that does not work, they contact MedCom in Jackson to find an open critical care bed somewhere.
But that could be anywhere from, the coast to New Orleans to Birmingham to, anywhere, just trying to get somebody into a bed that they need to be into.
Tuesday, in the state of Mississippi, the Department of Health reports only 144 ICU beds are available out of the 880 total as COVID-19 cases increase.
Ours is about 10 or 11 is the 7-day average, but that's where it was back in the latter part of July and the first part of August. It hasn't quite reached that top level yet, but it's headed that way.
Black says the hospital has a plan to move any non-COVID patients to their 10-bed general psych unit so they can use their 14 beds for COVID patients.
We'll put non-COVID patients in there to help protect them because that's kind of an enclosed unit, and then the COVID patients will be in our regular acute care side. We just feel like that's the best way to handle it right now.
Black also told me one of their most significant issues the rise in case numbers is creating is the amount of strain it's putting on the Winston medical staff members.